In our nation, a hidden epidemic rages. Because of the lack of education and care, oral diseases affect the health and well-being of an alarming number of people. A decade ago, the Surgeon General released a call to action on oral health in America, asking for a system-wide change. To date, many elements of his call to action have gone unheeded. And the effects of this pandemic have a huge impact on people, their health, and their lives.
I've had patients that actually lost their job because of their poor oral health. Have patients who can't get a job because they're not able to smile and communicate effectively.
Throughout the United States, many people are underinsured or uninsured and rely on their primary care provider for oral health issues. They rely on their primary care provider to tell them if there is a problem.
I would see patients that would come in with oral cancers and other head and neck cancers that had progressed to such an extent that they really had no treatment options. And seeing that day after day, and each time I would say to myself, someone needs to do something about this. And then month after month, and still saying, someone needs to do something about this. And then year after year, one day I realized that maybe that person was supposed to be me.
Oral health has been a hidden threat to our overall health and well-being for decades. It's important for us to have a focus on oral issues because oral problems, dental caries, dental decay is a preventable disease. It's a disease where we can really have an impact, where we can make a difference, and one that we haven't paid attention to for a very long time.
We continue to separate oral from systemic health, and therefore we oftentimes look past the mouth, right down the throat, and miss the real issue.
I recall a woman I was taking care of as a family provider, and she was pregnant in her third trimester. She developed a very bad infection in an abscessed tooth. And as it turns out, she became septicemic and had to be taken to the emergency department, and tragically, she lost that child. In that lady's case, I think everything would have been different had the group of us taking care of her remembered to think of her as a whole person. We were focusing on the baby and the pregnancy at the expense of the rest of her body, which included her oral cavity. And so in her pregnancy, no one thought to look and evaluate her dentition and to see whether she might have an active disease that could affect her outcome.
Oral disease affects all stages of life, but the most heartbreaking cases are found in children. Decay starts early and progresses quickly. In fact, early childhood caries is the most common chronic disease among young children, 5 times more common than asthma. But it's not just teeth. Decay can lead to infection in the face, the head, and the brain. Left untreated, those infections can even result in death.
Oral health, particularly oral diseases among our children, is the most prevalent chronic disease we have. We just don't see it as that.
Go back to the initial reason that you went into the healthcare field is that we want to help. We want to provide education. We want to provide information to patients. So it's not something that we're not already doing, but it's something you just need to switch the focus on a little bit. And for very, very little effort, there's a huge gain, a huge reward.
When Ms. Blakely first discovered my problem, it was very difficult. I was in a lot of pain.
I first examined him and saw evidence of a tooth abscess or a tooth infection, and also that his gums seemed to be inflamed and infected from some periodontal disease or gum disease that hadn't been treated. I could tell he hadn't had a lot of dental care in quite some time.
So if you're in a lot of pain, you don't feel like talking, you get very irritable, you don't feel like dealing with people, everyday things that you normally do.
I'm glad he came in early enough to say, you know, something's really wrong. I need to see what's going on.
She explained to me that this can cause other problems like heart problems and infection of the heart, and that can be very devastating.
Healthcare providers already understand the principles of screening, risk assessment, and behavior change counseling. All you need to do is focus a little more of those efforts on the mouth. The tools you need to start are free, online, educational programs like Smiles for Life, and other resources from the National Interprofessional Initiative on Oral Health. They are working with healthcare providers like you to begin the system-wide change.
Oral health is really the low-hanging fruit of prevention. It's a way to make a tremendous difference in the lives of all of our patients. And it's an issue that's been overlooked and undervalued and underappreciated in our healthcare system.
Won't you join the fight for oral health? Because ultimately, we're not just taking care of patients, we're changing lives.